And we're back on CentralValleyTalk.com. Thank you for joining us today. I'm Mike Scott, joined now by Neal Howard from InnovaRx.
Correct.
And you retired as a pharmacist, and now you couldn't stay retired. Huh?
I couldn't stay retired, not after some of the things that happened with my own in-laws. So I felt that there was a need for advocacy for elder patients in the Fresno area.
So explain exactly what InnovaRx does.
InnovaRx will do medication reviews, medication therapy reviews, targeted therapy reviews to prevent misadventures with medications in parents or anyone who takes medications, also with the aim of eliminating unnecessary emergency room visits. My wife has told me that she's never going to go to an emergency room again after we had our experience with her own parents when they were in their last months. And she refuses to step in. So we'd like to help. I'd like to help people avoid that. Also collaborate with physicians, go to the doctor's visits and discuss medication therapy with them, hopefully to optimize and maximize the therapy with the physician as the lead. And at the same time go to emergency room visits or hospitalizations when they do aftercare to make appointments with their primary physician, when invariably when you do aftercare they tell you to make an office visit or an appointment with a physician a couple of weeks after they're in the emergency room. So I would like to be the one to make that call. It takes 5 minutes and I can take care of it.
You know the right questions to ask,
yes.
Where to go.
Hopefully when the patients are in the doctor's office, I know from experience that particular generation that my in-laws were in, they very rarely ask questions. They just take what the physician says, and there's no problem with that. But they do not ask very many questions, and I'm there to ask those questions that would be difficult for them to make sure that they understand what they're supposed to be doing with them.
Okay, so as a former pharmacist, you would know if a prescription that they're given might be in conflict with another prescription that your client is taking.
Hopefully so. And then we
something the doctor should know.
Yes, but the system now is crunched and it's all compressed, so they don't get a lot of time to spend with the patients.
Yeah, the doctor's in and out of the room in 2 minutes.
Getting their work done. So I would fill that gap, do the evaluations for the patients, and hopefully if there's any interactions, let the physician know. Also, loop in with their pharmacy to synchronize their refills, so if they have 4 or 5 meds that run out on different days of the week, they don't have to go to the pharmacy 4 or 5 times a day to pick up the next refill. We could synchronize it with the pharmacy, and they would pick them all up at once, and it would make it a lot easier for them.
I've never heard of anybody doing this kind of thing before. How did you come up with this?
Well, it is something that's new in the profession of pharmacy. There's national legislation going on to try and make pharmacists providers for Medicare Part B patients, but right now we can do this for D patients, which is the one that has the prescription plans involved with them. They also require that they do what they call a comprehensive medication review at least once a year and do targeted visits for problems at least 3 or 4 times a year. So that's in the law as it stands now. So I'm trying to get myself started in the consulting business and see if we can help the patients here in Fresno.
My mom suffered from Alzheimer's, and when I would go up to Vegas to see her, I was amazed at the number of medications she had, and she was to the point where she had no idea what to take. If my brother wasn't there to manage all of her medications, she would have been lost. So is that kind of where you step in?
That's where I'm trying to step in. There is no advocacy. When I would come out of the office of visits with my in-laws in the last few that they made, I was always struck by the fact that I'm a pharmacist that had 40 years experience. This is still creates a lot of anxiety for myself and trying to deal with it as a family member. So I thought, well, what does a family member or what does a family do that doesn't have any connection with someone in healthcare? How do they handle it? Most of them probably go to the medicine cabinet or the kitchen cabinet, look at the boxes with their meds in them, and say, I just can't deal with this. So I don't even know. I don't want to know how mom or dad is taking care of this. I don't want to have to deal with it. So what I'm trying to do is fill in that gap, get in there and lessen the anxiety of family members, do the workup, make sure they'll take the meds properly and get the maximum benefit from it.
Okay. So how can folks find out more about InnovaRx?
Folks can reach me either at phone number 559-908-2742. I have a website that's in construction. We're not completely up with that yet. And they could also reach me at Dr. Neal at innova-rx.net.
Okay. Doctor of
Doctor of Pharmacy.
Doctor of Pharmacy.
Yes.
Okay, there is such a thing.
So it is a legitimate.
Are all
claim
pharmacists
to be.
doctors?
Some of the ones that are older than I am are usually registered pharmacists, but now the students that come out of pharmacy school, they're all mostly PharmDs, which is a doctor of pharmacy.
If you go to school to be a pharmacist, you're pretty much guaranteed a job for life, right?
It's been pretty consistent.
Yeah.
For the 40 years, I don't think I was out of work more than 2 or 3 months total.
Well, I've heard that some of the big, like Walgreens or those companies, will actually pay you to go to school if you agree to work for them for so many years.
That's probably true. That's
Yeah.
probably
I didn't want to name Walgreens.
Yeah,
That's
no,
the
no.
one that popped into my head. But
Yeah.
there is a demand. Obviously, the population's aging.
Yeah, and where the profession is trying to expand the role, get out from behind the counter, deal with the patients, do more thoughtful work with them in terms of managing their therapy and making sure they're getting the best benefit from it. So that is something that's coming within the profession. The issue's always been how do we get paid for it, but we're working on the first part to get it done for the community first, and then worry about the other thing later.
Cool. All right. InnovaRx, Neal Howard, thank you for coming on today.
Thanks.
Appreciate it. And we'll be back with more of Central Valley Talk.